And the KBCT viewer displays the image in anatomic planes because it's an isotropic three-dimensional CT image of the breast. So we have on the top left, this is a transverse view. The top right, this is a sagittal view. The bottom left, this is a coronal view. And we do have a fully rendered 3D view on the bottom right. So any of the views can be double-click to make it full screen. And we have tools here to adjust the size, the window and level, and move the images. So these are the basic tools that you can see in other viewers as well. So we double click and it comes back to this 2x2 view. In order to show the breast images to in line with the standard convention of breast imaging display, we kind of like to show the image in a similar way that a mammal was displayed, the orientation. So for our left breast, the nipple point to the right, and for right breast, nipple point to the left. So that's the standard convention of the breast imaging. And we have various indicators in the viewer to show the orientation of the image. So we have cubes here in each of the view. So you can see letters here in the cube that's mentioned lateral, medial, anterior, posterior, or head and foot. And we have letters in each of the window. So indicating the lateral, medial, anterior, posterior, superior, inferior, and all these are orientations. And meanwhile, we have a location bar in each of the window. All these indicators are trying to tell the reviewer what slice you are looking at and what's the orientation of the current breast. And we do have the crosshair, you can see. Whenever you drop the crosshair in any of the location in one view, the other view is co-registered in the same spatial location so that you can review the same location from all different angles, all different directions. The Koning breast CT eliminates the tissue overlap by 360-degree scan of the breast in 7 seconds, and also by displaying the image and displaying the image any location in the image from all directions. So there is no lesion to hide behind any of the tissue. If a study contains multiple series, and we have a side-by-side comparison mode in here, and we can just drag and drop the series into the comparison. I'll show you cases later to see how side-by-side comparison work. And the tool menu is on the top of the viewer. So you can see that you have some basic tools for display adjustment. We have tool for annotation and measurement. We have a tool for biopsy. This is a toolbox for biopsy. And we have tools for taking the screenshot and save the key images. And we even have a tool that can quickly remove the skin. We have some advanced toolbox here. We have a segmentation window. And if we come to a segmentation window, we have segmentation tools so that you can segment out any of the lesions so that you can measure the three-dimensional volume of the image.